Welcome, it's Friday the 5th of June and I wanted to carry on and look at a few countries and some interesting things that have come to my attention over the past 12 hours or so. So let's carry on. Well, I want to look at the UK, then we'll look at the US. So if you missed the previous video, do take a look at that. That's just the previous video we posted. But we're now carrying on with looking at a few countries. So COVID-19 update Friday the 5th of June. Now, the United Kingdom, the cases, of course, continue to increase, but we know this is a huge underestimate, as we'll see. There's between 8,000 and 9,400 new cases in the UK per day. So this lower estimate will be from the Office for National Statistics. This upper estimate will be from the COVID Symptom Tracker app. But of these, about 75% are not tested or isolated, and this is why the disease is continuing to spread. This is why the R0 in the UK at the moment could be 0.7 or 0.8 or even 0.9. We're not really sure because a lot of people are not testing and isolating. So I really appeal to people who are symptomatic to isolate and get tested until they're proved to be negative. Because the deaths are still climbing in the UK. By the time you watch this video, 40,000 people in the UK have died from COVID-19. And this is getting on for double the estimates that were put out by scientific advisors and politicians just about 6 weeks ago. Now, an interesting thing has come to my attention. MPs have voted to carry on or to reinstigate meeting in Parliament in person. And they have this curious old-fashioned system where they go through voting lobbies in queues or lines, if you'd say, in the States. And this is just crazy at the moment. It just makes no sense. You know, these people need to lead by example. And there was an MP working while obviously symptomatic, Mr. Sharma, Alok Sharma. So he was in the House of Commons and he was giving a talk. And he was obviously ill. I was reminded of that. Where are we? Pressing the wrong button. Sorry. Yeah, we're good. I was reminded of that Iranian guy who was that Iranian politician who was like mopping his forehead, and then he went off sick with COVID-19 the next day. Now, I think we have to assume that Mr. Sharma felt acutely ill. That when he was giving this talk in the House of Commons, he just started to feel ill when he was giving the talk. Because if he felt ill before that, he should have gone home and self-isolated. And if he thought, oh, you know, I've just got up this morning and I don't feel very well, to tell you the truth, but I've got this big speech to make in the House of Commons, I'd better go in anyway. I hope he didn't think that. I'm sure he didn't. I'm sure he became acutely ill because if he was feeling ill with those kind of symptoms that he had, he should have self-isolated until he was tested. So this is very important. If you suspect you might have COVID-19, you self-isolate until you can be tested, till it can be excluded. So presumably in this case, though, he just started feeling sick all of a sudden, and hopefully he went home as soon as he started feeling sick. It wasn't that he was feeling unwell before he was televised on the speech. I hope that's the case. Now, he's tested negative as it happened, so he's done the right thing. After this, he went back and tested. After this, he did self-isolate and went home. But the trouble is, if you're symptomatic, imagine, we've done this before, but if this is the course of the illness here, so imagine that line there is the first day you get symptoms. That's the first day of symptoms. And this is 3 days before, and this is 7 days after. Then the time you're most contagious is just after you get symptoms. It's that kind of, and then the contagiousness will go down as long as you stop being symptomatic. So if he'd just started feeling ill, then you would be at the most contagious time. This is the time it's most critical for you to self-isolate. But as I say, hopefully it was just because he started feeling ill all of a sudden and was taken a bit by surprise. Because sometimes, you know, I've been at work and I think, you know, you might be at work at, say, 10 o'clock in the morning, you think, you know, I'm not sure I feel great today. Then an hour or two later you think, well, actually, you know, I'm not sure I feel right today. And it could be a couple hours later where you think, no, definitely I'm not quite right today. I'm going to go home. I don't feel well. It can take a while to sort of dawn on you because the feeling of illness, especially with the virus, can kind of creep up on you over a few hours. But at the moment, we need this high index of suspicion. So glad to see Mr. Sharma did the right thing and self-isolated and got tested. But as soon as you start feeling ill, I think the key thing is, the message of this story is, as soon as you start feeling ill, self-isolate until you're proved to be negative. As indeed, I'm delighted that Mr. Sharma did prove to be negative. Now, while we're on politicians, Mr. Barry Gardiner, Member of Parliament. This is reported in the London Standard here. Now, I can't vouch for this. I don't follow him on Twitter, but this is the photocopy of his tweet that was in the Evening Standard. So this is what one of my members of Parliament has said. Been social distancing since March. Then I broke it to join the Black Lives Matter demo outside Parliament and take a knee with thousands of brave young people calling for justice. This is an MP, a leader of the country, patently breaking the rules, thereby patently endangering his life and the lives of those around about him. What we need to do, I've just listened to Nicola Sturgeon, who I'm not a great fan of. I'm not a Scottish, let's not go into politics. Anyway, I've just listened to Nicola Sturgeon, who's the boss of Scotland, First Minister of Scotland. And she said, you cannot go to Black Lives Matter protests at the moment. She said normally she would go to one or consider joining one because she believes in the cause. Fair enough. But she's not going to one now because it would breach social distancing rules. And I agree with her 100%. We forget we're in a pandemic and lives are at stake here. So Nicola Sturgeon, and I agree with her on this occasion, suggested that other ways of protest should be considered, such as demonstrating online, such as writing to your elected representatives, such as making financial donations to relevant charities. So for an MP to do that, really, regardless of it's not the cause, it's nothing to do with that. It's just for someone who's supposed to be leading to boast about breaking the rules. Just beggars credulity, actually. Now, face coverings are going to be compulsory on public transport in England from the 15th of June. Now it is the advice. Well, hooray, Henry. How long has this taken? I'll tell you how long it's taken. I reported on this first, I think it was the 26th or the 27th of March, because the Linda Bourouiba study published in the Journal of the American Medical Association on turbulent gas clouds and respiratory pathogen emission convinced me that wearing masks help to protect those around us if you are infected. So it's currently advice on public transport. So what I would appeal is everyone on public transport in the UK and in the world should not go on public transport unless they're wearing a mask. That's what I would advise now. And this is currently advice from the UK government, and it's going to be mandated, but not till the 15th of June. So that's another 10 days, isn't it? So why they're not mandating it now, I don't know. Now, part of the rationale for the government not, I don't think they admit to this, but part of the rationale for them not advising wearing face masks at an earlier stage was they didn't want to take PPE away from health professionals and things. But it's not a clever face mask, it's just something that blocks. So if you blow on your hands there, you can feel yourself talking. And that's what swirls around in the air. Now, what matters here is that you have something physically to block the flow of air. It doesn't have to be a clever N95 mask. So what we need to do is start making our own masks. So if someone wants to make me a video of how to make a mask, because I haven't got a clue, then I will put the link on my description, or indeed I will repost it on my channel. So there's a challenge. So if you're good at making things and you're good at explaining things, make me a video of how to make a simple homemade mask and I will post that. And that could potentially save a lot of people's lives. So coverings must be worn on buses, trams, trains, coaches, aircraft and ferries, mandated from the 15th of June as a condition of travel. Better late than never. going on about this for all this time. Now, just to remind ourselves, the Linda Bourouiba study, very interesting. If someone sneezes, the air can go turbulent, flow out of their mouth for 7 to 8 metres, 23 feet. If you cough, it can go for 5 to 6 metres, 19 feet. And just talking and breathing, 2 metres, which is over 6 feet actually. 2 metres is about 6 foot 6 inches. So the evidence has been there all this time. Because we know the virus is carried in these breath droplets. We know that. Right, moving on to the United States. Now, I think I just want to put this in a bit of context here, because these deaths look horrendous, and indeed they are horrendous. Let's just put them in a bit of context. And there we go. So what we have here is, this is the total confirmed COVID-19 deaths adjusted for population size, because it's so important to always do this. So if we look at this in a bit more detail, we see that, and this is a logarithmic scale here, of course, so we see that Belgium has got the highest deaths here per capita. The United States is quite a bit lower. The United Kingdom actually comes about there. I haven't put it on this graph, but it comes between Belgium and the United States. Nearer Belgium than the United States. Canada a bit down, but Brazil a bit further down, but Brazil is pointing up the way. You've always got to look at the kind of trajectory as well. So I just think that's important to keep this in context for the United States. That the death rate does look horrendous, and indeed is horrendous. 108,000. There's no getting away from that. But we do need to look at it in context of the population. Now, just a couple of interesting points about George Floyd. Now, Mr. Floyd tested positive for the virus, and this was interesting because they believe he'd had it sometime in the past, and that he just had residues of the virus in his system. So would probably no longer be infectious, but it's okay, it's a sample of 1, but it does indicate that a lot of virus has been around in that area. And Mr. Floyd also tested positive for fentanyl, methamphetamine, and tetrahydrocannabinol. Let me be clear. I don't want to get into trouble or upset anyone. This had nothing to do with his death. He was killed by someone kneeling on his neck. Let's be clear about that. Outrageous, unacceptable, deplorable, appalling. I could go on. But I don't know how common fentanyl, methamphetamine and THC use is in these areas in the States, but it's a bad combination. All of these affect the way you think, and if people are taking these drugs, the decisions they make aren't going to be as good as they would be normally, and indeed they could be more risk-taking. So it's not good for the spread of the virus generally. So I would say here, what I would say to friends with any of these difficulties is try and look out for each other. So, if you've got a friend who's taking not the best decisions for whatever reason, then, just try and come alongside and try and help them a bit. Now, let me just tell you what I think here. I've got these notes. There's no doubt in my mind. I've had quite a few emails from the States, and people are saying that these protests, which I understand, an outrage has been committed. I'm not demeaning the outrage at all. But 2 wrongs don't make a right, and these protests are breaching social distancing, as we've just seen with this MP in the UK, as we're seeing all over the States now. Now, these are decisions that people are making. Not my job to comment on American politics. I don't understand it at all. But what I would say is that as a result of what's going on all over the States and throughout individual states, is I would expect cases to increase over the next few weeks, dramatically. There's no question in my mind this is going to greatly accelerate the spread of the virus. As a result of that, deaths, in my view, will increase in the weeks after that. I'm making no comment on the rightness or wrongness of it. This is as I understand the spread of this virus. There's going to be greatly increased cases all over the United States. And with the usual time of 3 or 4 weeks after that, there's going to be an increase in deaths. And what we can say is in the past that proportionately more African Americans have died than white Americans. And I believe that will still be the case into the future, because no one seems to be talking about improving the immune system of people. And there's certainly no one seems to be doing any randomised double-blind controlled trials on vitamin D, which is a pity. So what I predict, purely understanding the transmission of this virus, is that many African Americans are going to die as a result of these protests. And when I say many, it could be a lot. Don't want to put numbers on it. But unfortunately, there is no question in my mind, a lot of Americans are going to die as a result of these protests. And what I'm particularly concerned about is that this could cause such an acceleration. So, I mean, let me ask you, what has the R value been in the United States this week? You know, is it been 4, 5? I don't know. Do you know? It certainly won't have gone down as a result of these protests. That's for sure. And what that means is that many people in the next month could be getting sick all at the same time. And potentially that could mean that the health services in the US are completely overwhelmed. And that could potentially dramatically increase the case fatality rate. Let's hope I am completely wrong and I've completely misunderstood that situation. But if I have, I don't see the fault in the logic at the moment. The behaviours in the States at the moment will have serious consequences, in my view, including multiple deaths. Many, many deaths. Now, still on the United States, just to mention this, the Centre for Disease Control advocates mask wearing. Now, this graphic, I think, is from the Centre for Disease Control. Your face covering may protect them. Their cloth face covering may protect you. Yeah, that sounds reasonable. And both of these people are sporting nice homemade masks, as we've featured many times. Don't forget, I want some videos on making masks, please. It's outside my skill set, so look forward to those. Now, what's the CDC saying here? Wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain is good. Yep. Cloth face coverings may slow the spread of the virus. Remember, these are homemade ones we're talking about now, just cloth ones. Help to protect people who may have the virus and do not know it from transmitting it to others. So, of course, many people don't know they've had the virus or have the virus. It may be made from household items. So I look forward to learning how to make masks. And I am going to give it a go. I'm going to try and make some masks. If there was actually, I might delegate that, but anyway, do send me a video in. Now, South America. South America. Nicaragua, for example. Officially, there's just over 1,000 cases, 46 deaths. Now, Daniel Ortega has not been the sort of leader I would prefer for this, and indeed encourage people to carry on as normal. Unbelievable. It's like a video of what you wouldn't do. There was a rumour around that the virus only affects the rich, so don't worry about it. And there's water supply problems in the cities apparently, so hand hygiene's a problem. And informed sources in the country put deaths at the moment at around about 1,000, or not much below 1,000. So these figures are not accurate. So Nicaragua, of course, already a very challenged country, and it's going to make it worse as cases greatly increase. And Brazil, which is slightly better documented, increasing cases. This is the deaths in the last 24 hours. But of course, this death number is a great underestimate. But even that's a record number of daily deaths. Now, the reason I'm saying it's an underestimate is I watched a very detailed report from Al Jazeera, which was excellent, on the rural Amazonian areas, very poor areas in the Amazonia area, and large number of deaths there. Basically, a lot of people are dying, and they had upsetting pictures of mass graves and things. But there's no testing. So why are these people in these poor Amazonian areas dying? Is it coincidence that they're dying in much greater numbers during the COVID-19 pandemic, or are they dying from complications of COVID-19? Clearly, it's likely they're dying from complications of COVID-19. And there's essentially no testing in these areas. There's COVID cemeteries and multiple graves. Brazil is not yet at its peak, and the lockdown continues to be lifted. So we heard about problems in Brazilian cities. Now we have this film documentation of the spread to the more rural areas of Brazil. And as often is the case, the poorer people are suffering disproportionately. It really is a terrible, terrible situation. Poor people dying disproportionately. Now, Egypt, cases and deaths. I think the public health infrastructure in Egypt is not too bad, actually. I don't pretend to have detailed knowledge, but there's some interesting information here. But what caught me here was the Egyptian Health Ministry are just distributing 1 million doses of vitamin D to quarantined hospitals for the staff. To protect the staff. Good news. The Egyptian Health Ministry believes that vitamin D will improve the immunity of the staff, because the staff have been working hard for months and have hardly been out. They've got darker coloured skins anyway, typically in Egypt, so they'll make vitamin D slowly. Although it can be very sunny there. But the point is they've been working in these hospitals all the time, so they haven't been outside to the sun. So the vitamin D levels will be low. The Egyptian Health Ministry have said an important element to support the immune cells working. They put it in, this is obviously translated. This is what they say: an important element to support the immune cells of the doctors treating coronavirus COVID-19 patients. So they're saying that the vitamin D will improve the immune cells of the nurses and doctors working with COVID-19. And they also, again, this was translated, that they stay for a long time inside hospitals without being subject to sunlight. Makes perfect sense to me, Egyptian Ministry of Health. I'm delighted to see that you are doing that. I would also hope that the British and American, United States and other ministries of health would maybe put in a phone call to the Minister of Health in Egypt and maybe learn something from the Minister of Health in Egypt. Good, excellent news. Now, West Africa, Africa generally really, Senegal. Now, the pandemic is behind the curve in Africa, but I have great concerns for it because of the poor living conditions and the other pre-existing diseases, the dengue fever, the malaria, the malnutrition, all those other, the undiagnosed hypertension indeed, which is surprisingly common in Africa. So quite a few concerns there. State of emergency has been extended in Senegal to the end of June. But in Dakar, for example, riots protesting of lockdowns. People are going hungry as a result of this. And there's also the particularly dry season and so distressing pictures of cattle dying of thirst. You know, where you have a situation where you can't actually get water to your animals is just terrible. And you can understand why the people are saying, well, no, we can't lock down. It's just not possible. We'll go hungry if we lock down. And yet that means there's going to be more spread. So but let's hope some water engineers sort of start getting. These things cost peanuts if someone would just be bothered putting in some kind of water infrastructure. Plastic water pipes are pretty cheap, Anyway, South Korea. Now, South Korea, great contact tracing. Track and trace systems are good. Now, this is why I put this on. They can track contacts, apparently, using the mobile phone app. Their contact tracing people can now contact all of the people that. So basically, you have an infected person there, and that person's infected, and they can come into contact with all these other people. And once this person has been identified in Korea, all of these people here can be notified that they are at increased risk in 1 hour. Absolutely brilliant. So they can then trot off and self-isolate until they're tested. If they're tested negative, fine, return to normal duties. If they're tested positive, fine, we know what to do about that. And this linking, once they've identified an infected person, these people will receive a text saying, "Oi, under risk here, mate, go in lockdown until you get the test." And the messages are sent out as emergencies to their phones. So excellent. Quarantine app monitored for 14 days on arrival. So the app also monitors people that arrive in the country to make sure they're self-quarantined for 14 days. Now, the app for the UK, I believe, is being rolled out from the end of... Is it the end of this month? Is it the end of June? Anyway, the next few weeks, the app is going to be rolled out in the UK. So the hope is in the UK that we will also be able to identify an infected person and warn their contacts of their potential further infectivity within an hour. And then, of course, that's going to stop them infecting other people. So we are breaking these chains of transmission. When this person's contacted, these people should remain oblivious and not infected. This is the way to go. People worry about the app. In my country, in the UK, at the moment, I worry about the app in some situations, but personally, I'm going to download the app. I'm much more worried about downloading the app in certain other countries than I would be in the UK. So, not saying I trust everyone entirely. You can't do that, but I'll be downloading the app. Now, this was interesting. Going back a bit, talking about South America again, really. So this line here is the United States. So we see that this is a daily new confirmed COVID deaths, and again it's this logarithmic scale. So we see that thankfully the daily numbers in the US are coming down, and we're down to here now. That's the United States line. But the Brazil line, unfortunately, is still going up. It's pointing in that direction. And the way things are going in Brazil, I would expect that to probably carry on going up. But the thing we notice here is that that's the United States at the moment, and that's Brazil at the moment. So what we actually see, if we draw that line there, is that the daily deaths, and this is just in terms of numbers, not per capita, we see that the daily deaths in Brazil is already slightly higher, not a lot, but slightly higher than the United States. Of course, what I'm worried about now with the situation in the United States is that there'll be a delay where the deaths hopefully carry on going down. But then what I'm worried about is they're going to start going up again as a result of the infection that's inevitably happened in the last week or two. Let's hope I'm wrong. Let's hope. I really hope I'm wrong. Let's hope it keeps doing that. But it may not. Mexico, definite upward trend here, isn't there, in Mexico? Canada, I would say the trend overall is downwards, which is more encouraging, or flattish. It depends. We don't know how these curves are going to go, of course, but it was just interesting to look at. And total confirmed COVID cases. Now, this one is adjusted for population per million. So again, we have now this is a linear scale. Just look at the scale here. So it's a 1, 2, 3, 4, 5,000 cases. So it's a linear scale. And what we see here is so this is cases, not deaths. Total confirmed cases. Cases per million of the population. Cases. So what we see is Spain. The cases are flattened off nicely. So that's the Spanish line. That's the Spanish line there. That's the Spanish line. They've levelled off, which is good. The United States, though, the cases are still increasing on this graph. The United Kingdom levelled off somewhat, but still cases still increasing, as we saw, by about 8,000-9,000 per day. And what is concerning here is just look how steep the Brazil line is. It's rising sharply. It's by far the steepest curve. And let's hope Canada continues to level off and level off there. So that's total confirmed cases. So because it's total confirmed cases, of course, it can't go down. It can only become flat. That's the best we could hope for. But look how steep the Brazil line is increasing. That is really, as of today, that is very concerning. Now, China. Now, what I meant to do was take time to learn how to pronounce these places, and I haven't done so. Where am I? Yeah. So now, this is the city. This is the province. I'll learn to say it for next time. Northeast city near the Russian border. We said weeks ago we were worried about cases coming from Russia, where the level of infection is high, into China. So there's a city here that's infected. So what are the Chinese doing? Well, they've imported nearly 1,200 medical personnel. So they've gone there into this city, and all they're doing is testing 2.8 million residents because they found 15 asymptomatic coronavirus patients last week. Everyone is going to be tested by Saturday. So this has been going on for a few days. So basically within a week, because there's been a few asymptomatic cases, the Chinese are testing 2.8 million people. Then they'll know. That is impressive. And this is reported by several international news agencies, so I do believe it is correct. So test, trace, isolate is the Chinese strategy, and we know it is working. So impressive capacity of testing, keeping the cases in China well down. After a bad start, the Chinese have got better and better, and this is impressive. I know I'll get criticised for saying that, but I'm impressed by 2.8 million people getting tested in a week. If you don't like that, tough. I think it's impressive. I wish we were doing the same. And as I say, several agencies have reported that, so I believe it to be accurate. Now, the last thing I want to do today is Germany. Now, I'm not going to go into the figures, but just as an illustration for everyone, really. German Centre for Addiction Issues. 3 million Germans between the ages of 18 and 64 have already got an alcohol problem, and alcohol sales were up quite markedly during the pandemic lockdown. So it appears that people are at increased risk of alcohol use, and indeed, as we looked at already today, drug use at the current time. So obviously try not to take these things yourself, and if you know that friends, family members, if you know that friends are drinking too much or taking drugs, pick up the phone and come alongside them and see if there's anything you can do. Very often just someone else knowing about the problem can be transformative as we come alongside our friends and relatives to try and help them at this time. So, I think we can look at some Friday people. Yeah, we can. So this is Bernard from Michigan. Now, this is one of my old videos, this. So that's a really ancient one, that, on the gastrointestinal system. Now, I have put... I've forgotten that one was still there, actually. But thanks for watching, Bernard. I have put more recent videos on the gastrointestinal system up if you want to study the whole system in detail. It's there and it's available, as are my videos on all the systems of the body if you want to learn a bit about anatomy and physiology. That's a proper old one, that, Bernard. I might take those old ones off, actually. They're a bit embarrassing, but never mind. This is Kylie. Now, I'm pretty sure Kylie is in Australia. Is it Sydney, Kylie? I'm sorry, I can't remember. I'm pretty sure it's Australia anyway. But thank you for watching. Weather must be getting colder in Australia. Oh, that's Kylie wearing a mask that she has made, I believe. So, nice one, Kylie. I'm looking forward to some videos on how to make masks. Do remember that I will repost them on my channel very happily if you would like me to do that. This is Lawrence and Wendy, who live in Battle, which is in East Sussex. And of course, Battle is named after the Battle of Hastings, which I seem to remember might have been in 1066. So glad to see that you are watching, Lawrence and Wendy, in East Sussex. Thank you for watching. Oh, that's the 1 cow apart one. We've done that before, but it's a good advice. Keep 1 cow apart at least. This is Luna, who watches in the UK. So thank you for watching, Luna. Don't know where you are, but pleased you're watching. This is Martine, who watches in Belgium. Martine is a psychiatric nurse in Belgium, and he highlighted the importance of mental health issues during this pandemic, for which we are, of course, grateful. Oh, this was Margaret in Queensland in a care facility. 2 metres distance determines our existence. One of our trustworthy sayings. There she is. Now, I think Margaret sneaked on twice, but you're very welcome, Margaret. Always pleased to have you on the video. Anytime. Thank you for sending your picture in, and thank you for watching. This is Margot and Kevin, who are in Georgia. You're watching in Georgia, so good to know you're watching over there in the States. Thank you for watching. This is Marcia, who is in Portugal. I do hope you don't burn your hands while you're watching when you're cooking, Marcia. I'm sure you won't. You're obviously highly skilled. So thank you for watching in Portugal. Excellent. This is Mark from Portsmouth in the south of England. So glad to see you watching in Portsmouth, Mark. Now I think Karen sent these in. These are hand hygiene facility in Tanzania. So presumably the home doesn't have any, or the facility doesn't have running water, but outside does. So that's good improvisation. Very clever. Thank you for sending that in, and thank you for being an example to us.